So as of this morning, per the Bloomberg tracker, states in the US have administered about 30% of the shots that they have received. In many places, at least in one county, they had to offer a reward of $750 in a health system for employees to come and take the vaccine. So we have a situation where the vaccine is ready, it's sitting in health systems. The providers are present, but we are not being able to administer it. And that again gives you a scale of the problem where 70% of the vials are sitting there.
Central government, I believe, is building an app while this data has been sent over. The state also needs to monitor and track who they have been vaccinating and how much of this vaccine or what quantity of these vaccines has to have to be distributed across the different zones or across the different, so to the lowest level of administrative boundaries. So they are working through it, and the system that I talked about in the first place is something where they need to be able to consolidate not just the supply chain and the distribution data, but also identify the people. What are the validation techniques they need to put in? So they're looking at some sort of an Aadhaar or some sort of a government ID related validation. So how does that data flow back in? And how do we ensure that we tag these people on the system so that they don't come back for a second vaccine or they don't miss out people and stuff like that. So the verification, the supply chain and the operational reporting on the supply chain to ensure that things actually happen smoothly, and the different processes that are setting up, and being able to report at the granular level of the processes is itself sort of a big task. And we're looking at multiple systems. As with when we started COVID, we realized that none of the government infrastructure exists on any single system. Generally, they are on-premise systems, and COVID. The fact that COVID itself limited our capability to work on-prem systems going to their centers. We've set up large cloud environments. The ability to link cloud and other platforms is a big challenge, and how do we solve for that? While still understanding the process on the ground and being able to build systems at pace. So we don't have months, we don't have BAs, we just have a set of instructions, and be able to sort of quickly understand and build it is where I see, it requires a lot of sort of mental or technical capabilities in that space, along with so this is where we always focus on in Fractal, right? So bringing together the key components A, E, D to be able to build a system that can handle this scale and also be able to sort of support the scale of operations is sort of the first key challenge. The second one is on the execution support. So as I mentioned, ASHA workers, so people have phones, and generally Android phones, and their phones do not have large screens. So how do you build apps and what information to push? So when they're collecting information from people, they do go through some of the basic validation checks like name, Aadhaar number, or mobile number. But how do you administer the vaccine? How do you scan the vaccine? Does it go through a QR app, or does it go through some sort of a code? How do you ensure that the vaccine is going to the right person? And how do you train these people to actually do the right thing, right? They may not administer anything at all. They may just be clicking and entering false information. And we're looking at 40,000 ASHA workers that will be collecting some of this information. And how do you ensure that these people are capturing the information right?
So certain things about the COVID context has sort of activated hesitancy in general population, which was latent. And some of these things are, the information overload. Never has a vaccine been developed under such public scrutiny and so much media coverage. And that has led to a lot of information. A lot of information is, contradictory. And this leads us to the next point, which is the crisis of trust. That once you have such an information overload, you really don't know how to make sense of it, right? How to get meaning out of information. And to get meaning out of information, we trust in certain institutions, in certain experts. And that has also broken down during COVID, because we have seen experts and institutions make mistakes, falter, change their own prescriptions For example, when it comes to masks or when it comes to lockdowns, leaders, scientists have gone back and forth, and that has created a trust gap as well. And next is misinformation. When you don't have credible, trustworthy sources of information and there is information overload, a lot of people are likely to fall prey to misinformation. And there is a lot of misinformation. There was a lot of misinformation about source of COVID and COVID transmission, and now there's a lot of misinformation about vaccine, particularly to do about vaccines side effects. And we'll come back to this topic in a second. Next, we have desensitization to risk. We have been, entire population of the world has been exposed to extremely high levels of risk for an extended period of time. Now, what we have seen in terms of behavioral understanding of risk is that that level of caution and risk sensitivity cannot be maintained for a long time, because risk is always a stressor. And when we have an extended stressor, then we try to sort of be in trying to cope with it, we get desensitized to it often. And that's the state we find ourselves in. A large part of population right now thinks that COVID is manageable now, and they don't feel they're as much at risk. So now these things existed even before vaccine arrived. Now, as vaccine arrives and the rollout of vaccine begins, we should anticipate a completely new set of challenges. And that's mostly to do with the adverse events or side effects, negative side effects of vaccine aspect. Now, this becomes very important in terms of uh, a behavioral cognitive bias called negativity salience, or a form of it is loss aversion. You would have heard about it, that losses loom larger than gains. Similarly, negative information is more salient to us, attracts more attention than positive information about any topic. And it also on our social platforms gets amplified much more. Outrage campaigns, hate campaigns, they get amplified in social media much more than positive campaigns. Now, what does this mean for COVID vaccine? We have already started hearing about adverse events following immunization. The first events were recorded in UK, which also started, the vaccine rollout campaign first. And adverse events are to be expected. A vaccine or any pharmaceutical product will react differently to different people, and some people will have these unexpected negative events. Now, the vaccine can have adverse events and still be categorized safe if these negative incidents are a small quantity and are outweighed by the benefits of vaccine. And that seems to be the case, right? We are not hearing of a lot of adverse events. So if there's like 1% adverse events out of 100 people that will get vaccinated, 1% will have negative effects, say, right? But when you think in terms of what story will people give more attention to, or will receive more attention in media, or will get amplified in social media, it's the one adverse event case and not the 99 people who just nothing happened. And that's the problem with negativity salience, and how adverse events are going to be perceived. As more of them stack up, the percentage of adverse events can be very low, but the numbers of vaccination that we are going to see roll out over the next few months and a year, uh, those numbers of adverse events are also going to stack up. Now, what do we do about it? Ram spoke about a behavioral segmentation exercise that we are already undertaking. What this would do is try to identify different population segments which have different kinds of hesitancy. Is it driven by trust? Is it driven by social contact with someone who has adverse events? Is it because of misinformation? So identify those drivers and then customize and target these people with customized information and prompts and communication. So on social media, the framing of the kind of communication that you are giving to them can be customized. So should it be in terms of social proof that people around you are getting vaccinated? So you should do, is it social responsibility that you should protect the vulnerable by getting vaccinated? Things like that. And then nudging, and AI can come into, both the nudging and the framing of communication, where we look at default opt-ins, that you are an automatic vaccination is already scheduled, and then you can opt out, and that's easy. But by default you should get vaccinated. Similarly, reminders, perks, you can have a health ID which lets you sort of fly or enter certain public spaces. And technology has a part to play in this, because all of this customization and targeting can be programmed once we understand the data and the insights coming from behavioral science.
Okay, so then we talk about how engineering is a key enabler in this whole process, and how being an enabler is very critical for ensuring the program success, right? So both the compliance, which is the dose delivery aspect, and the adherence, which is basically tracking the target versus actual vaccinations that have been going on. These are two very important goals that need to be tracked, right? And the steering team will have access to regular automated reports to keep a check on the progress. At the same time, whatever system we build, the architecture, it should be flexible to accommodate real-time event processing as well as pattern mining. So these capabilities are also of much value here. They may not be readily used, but some use cases are definitely there as of now, and some may come up in the future. So having a system that can implement and be ready to use both of these would be very helpful. So for example, real-time event processing can be used to provide immediate care to a recipient, suppose who has an adverse reaction to a vaccine, right? And pattern mining could help us understand if there are any drug-drug interactions which we don't know yet. And once we've analyzed the data, it will come about.
Yeah, definitely. So I think comprehension and engagement with these apps and digital platforms is going to remain a challenge, especially at scale. At smaller scales, you can sort of manage it. But to roll it out over the country, those challenges are going to remain and will have to be, worked with. Of course, language is an easier barrier to sort of develop these platforms in regional languages and so on. But we have seen that technology is not something that a lot of women coming from rural remote communities are exposed to, and hence and hence have emotional barriers, are slightly intimidated with technology. And that is something that we anticipate. That is something that we will start seeing as it is scaled up, and the government will have to look at. And of course, there are interventions from behavioral perspective, from design perspective, that can look at improving that engagement, improving comprehension of frontline workers. On the second issue, which is corruption and data quality, that is sort of a much bigger concern. And yes, the data quality, health data quality in India, there are large state disparities, but overall quality is inadequate. The favorable reporting is a real issue. So these registers are often filled up all together in the end of the month, where you have to meet certain targets. Information, even the beneficiaries are often not able to provide the right kind of information, and hence FLWs have to cook up information in a lot of cases. So those are going to be problems. I think we would have faced these problems, and I think Dinesh maybe can talk about, even in case of COVID monitoring, we would have faced similar problems, and those we'll need to continue to sort of look at. But I think it will become more important as there are more perverse incentives for frontline workers. So when the demand for black and gray market vaccinations also grows, there'll be more pressure on frontline workers there'll be more incentives for them to misreport data and siphon off some of the vaccination. Similarly, when the government becomes more aggressive on targets that frontline workers have to meet in terms of vaccination, that is another factor we have seen in terms of mother and child health services, for example. Once you have top-down targets coming in, then people tend to misreport more and provide more sort of favorable data. But yeah, these things I think will need to be tackled in the design of these platforms and with sort of live data coming in.